The disparity in healthcare is something which we should not allow, and we should not allow to persist in this greatest country. Everybody should get the equal healthcare, and they should get the good outcomes. And we are struggling and making sure that happens all over the country. In New York City, we have really taken this on a bigger level. We believe that healthcare cannot be delivered in isolation. It has got to be delivered taking into economic and social conditions of the neighborhoods. So as you move on to expand our ambulatory care, we are very cognizant of where we have those care models placed. So we make sure that the place where we have the healthcare is easily accessible by transportation, where there is enough good food available, public safety is available, where there are enough jobs, right? All those things need to be taken into consideration if you really wanted to improve the health of a population. So more and more, I think, in the population health, it is not only about the health, it is about the population. What we have done was, in New York City, because homelessness goes a long way in improving the health outcomes of the people, we have really built supportive housing in many of our campuses. Because as we downsize our inpatient model, right? For example, Kings County has got a large campus, which is Central Brooklyn. So we have built two models of supportive housing with Canva, so that the people get housing, and also they use healthcare in our system. But we are also making sure influence their outcomes, because now they have a housing as opposed to being homeless. Second model is that as we are expanding our clinical services and ambulatory services to the parts of New York, we are picking them up as we are locating them in high need neighborhoods where there is healthcare disparities exist. In the past, people have really done with the healthcare delivery system is put the clinics where it is feasible. Now we are much more careful in selecting locations. We want to make sure that the clinic is located in a high need neighborhood where there's a lack of primary care access. We want to make sure as you put the clinic in place, there is enough transportation available to reach the clinic. We want to make sure there is enough public safety around it. So those are some of the things we are following right now. We are going to open 6 clinics by the end of this year in New York City in need neighborhoods where there is a disparity in healthcare exists. By statistical or by community needs assessment we have carried out. But this is going to be a different way of expanding healthcare, not just expanding based on where we get a place to put a healthcare. We will be very consciously working on different communities by zip code, trying to improve the healthcare of those high need neighborhoods. As the largest public hospital system in the country, the expansion of ESEA has helped us a lot, because it was able to get insurance to a lot of folks who never been in insurance market before. But it also did not allow undocumented immigrants to get into the ESEA market. So in New York City Health Hospitals, we take care of close to 475,000 uninsured population each and every year. And that is a large financial burden on a public system. But our mission is to turn no one away. So we'll continue to provide care for those population, even though the federal subsidies and state and city subsidies, which will compensate for that care, is dwindling over the period of time. And we are working collaboratively with the 250 different healthcare associations, leaders, as well as systems, as well as community-based organizations to transform the healthcare from inpatient module to an outpatient system. So that is already on the trajectory, and we are doing well. We also reorganized our own structure within the health and hospital from a geographically based network structure to a service line model of having ambulatory care takes a much better and more visible, higher role in the organizational structure. So we are shifting away from inpatient care to more of outpatient care.